Hola mis amores, ¿cómo están? I'm Tia Gloria and welcome to Tea Time with Tia Gloria. This week I'm gonna have so much fun because we're gonna go educational. We're gonna have to learn something, because everything cannot always be fun or everything cannot be always party, but we're gonna educate ourselves by having fun. And while I'm talking about fun, I'm gonna have my little tea, but before I'm gonna put my little creamer. And my creamer, I'm in a polyamorous relationship with Don and Julio. So if you know, you know. So like that, we're gonna have a little more fun with Tia. All right, mi amor. So I'm gonna pour my gas, and I'm gonna pour myself, and I'm gonna let you know that this week we are receiving a doll. This person is doing so much here in Vallarta with the Vallarta Gay Community Center. And I'm going to present you this fabulous person that is like the hidden angel behind everything, the executive director, Mr. Pedro Lopez. Hola, mi amor.
On air from Stud Studios, it's tea time with Tia Gloria. She's bold, she's loud, she's a queen, she's a diva, but she's your Tia now. Tea time with Tia Gloria. Make yourself comfy, make yourself a drink. Tea time with Tia Gloria. Water's boiling, the tea is ready. Tea time with Tia Gloria.
Hola, Tia Gloria, you are much too nice to me.
No, baby, you do so much behind, and I know that you're not an upfront person. You don't like those lights and all the tank and all that, but it's really important for us to have a little chat together, because I think that people think when they think about the Vallarta Gay Plus Community Center, they're like, "What the fuck?" It's like, what is it? What is it? So we're going to go through that. I'm so happy that you accepted to be my guest this week on this show. First of all, salud, mi amor.
Salud.
Cheers. Ah, hot like my lover. Boiling like the tea. So, mi amor.
You must have given me something different.
Oh, it's Don and Julio. You will know. You will know. Mi amor, I want the people to learn, who are you?
First of all, thank you for having me here today.
Pleasure.
So a little bit about myself. I'm Pedro Lopez. I am originally from Jalisco, but I migrated to the States, California, at the age of 2.
Okay.
And at the age of 50, I decided to retire and come back to Jalisco. And it had always been a dream of mine to come to Puerto Vallarta.
It's back to your roots.
Back to my roots. So I'm a psychiatric nurse by training.
Okay.
So all of my professional career in the States was working in community mental health, specifically in mental health services, serving the underserved communities of the LA area.
Perfect. In Los Angeles. And this is kind of because you're in the mental nurse. Sometimes people don't see that, and it's really, really a hard job for we see the happy place, but we don't know that this job is asking a lot.
Well, I was very fortunate in that I landed in a job that I loved, and I loved for already 30 years, for over 30 years, and it never felt like a job.
Oh, nice.
It felt, I was very lucky and blessed to have landed there.
That's so fun. Because it makes more than 30 years you are into this business, right?
Yes.
Wow,
Yeah.
30 years, and you're not getting bored?
No, well, moving down to Puerto Vallarta, I had the opportunity to retire and come back here. And I had done nothing for 4 years.
Okay,
And I decided I was going to volunteer as a nurse doing something
okay.
2 days a week. And I came across an organization that was just starting.
Okay.
And I reached out to them and told them I was interested in volunteering for two days a week. They had seen my resume, they reviewed it, and then they said that what they really needed was an executive director. And
Nurse
I was
director, like
so
call about a promotion.
well, in my last position, I was vice president of a large mental health facility that served the larger area of LA County.
Nice.
So I had executive experience, and part of my responsibilities were setting up clinics, mental health clinics, from the ground up.
Wow.
So everything. So when the board saw that, they wanted me to step into that role, and I didn't think I was really ready for it.
They were pushy?
Well, I just wanted to work 2 days a week, you know.
Well, it's all about
volunteer.
that, baby. They ask you for 2 days, after it's 3 days, after it's a full week.
Yeah.
I know what I'm talking about.
But you know, my heart's been with the community and working with the underserved, and Mexico in general has a big need for services and outreach to our LGBTQ community and prevention for HIV and STIs. So it's one of the areas that I had an interest in. So when this came about, I had to speak to my husband to make sure that he was okay, because me getting a job after being retired means I'm pulling him out of retirement too, because now we can't do the things we used to like to do. But it's been very rewarding. I think I am very fortunate to be part of the Vallarta Gay Center as it started, and very fortunate to work with the board we have.
Yeah, because the Vallarta Gay Plus Community Center is brand new. Actually,
Yes.
it's what, 2 years now?
It'll be 2 years in February.
And because I remember at the beginning, there were another center that closed,
Yeah.
unfortunately. And after that, you guys, like, with a bunch of other people, just pack it up
Yeah.
and explain to us what happened.
So back in, what was it, September, October 2023, the other organization that was providing PrEP and PEP and prevention services to the community here had to close its doors. So it left a gap. And there was several local businessmen who felt that was a big gap, and the services needed to come back to the community. So there was Don Pickens from Casa Cúpula, Mike Owens from Studs, Mikel from Thrive, Jet from Jet
Jets
Naked
next
Tours,
door, Jets Club, Jets. We know Jets.
yeah, Jets. And I believe in the beginning there was also Javier and Matt Karimi, who's now our treasurer. So they all got together. They felt it was a need. They were able to fundraise to get the thing started, and they were able to bring on a doctor, a nurse, and they started seeing clients out of the Thrive Clinic.
Wow.
So
I
very
remember that,
fortunate
yes.
to have Mikel on our board to support it. So they started in February, and in end of March, I came on board.
Okay.
So it was my responsibility through the guidance of the board to help identify a location, modify the location to make it work so that we could provide services to our consumers. And primarily, our primary focus was prevention, making PrEP, PEP, and DoxyPEP available to the community, and then offer testing. But our ultimate goal was to have a community center. Because, you know, prevention does involve PrEP, PEP, but I'm a strong believer that true prevention involves the community.
For sure.
And creating a community center, an alternative place for people who are part of the LGBTQ community to come in, be able to meet people outside of our normal meeting places, and create relationships outside of our normal LGBTQ meeting places, creates a community. So within the center, it started to expand, and now we have 13 different activities throughout the weeks. Salsa classes, yoga classes, Spanish classes, English classes, drawing classes, and all of those services that we provide out of the community center are free.
Wow, we're gonna come back after that, because this is like amazing. We're gonna have a word from our sponsor, but we're gonna get through that. So stay tuned, because in 2 minutes we're gonna be with you. And we're back at Tea Time with Tia Gloria. I'm with Pedro Lopez, Executive Director of the Vallarta Gay Plus Community Center. We were talking about before a break of all that you bring to the center, all the other activity. What service can we get at the Vallarta Gay Center?
So there's a multiple layer of services that you can get. We have a doctor, we have a nurse, we have a prevention specialist, we have a volunteer coordinator, we have a receptionist, and we have me.
Okay.
So one of the things I would say the priority or the main focus is making sure that we identify people that are living with HIV to be able to get them connected to services.
That's amazing.
Recent studies say that about 35 to 40% of the people that live with HIV are not aware of it. So getting people tested and connected to treatment when they need to be in treatment is prevention.
Why do you think this is happening? That a lot of people don't know, they are scared, or it's still a stigma in 2026?
I think the stigma of living with HIV is still very present with us. And I think back in the 80s, back in the 90s, having HIV was pretty much a death
Oh,
sentence.
it was death row.
A death sentence. And now
They were calling the gay cancer.
yeah, and now it's not. But people still hold on to some of those beliefs. So helping us get people tested and get them connected to services means that once they started medication, within the first 2 to 3 months after starting medication, they could test negative,
That's amazing.
where they bring down the viral load to an undetectable level.
And I have a question. I know that the people at home are asking this. There's a big thing about so what you just said, it's like when they are untransmissible,
Undetected.
it's mean that they cannot transmit
They
it.
cannot transmit.
Can you explain to me, like, if I was 5 years old, gay boy, on poppers, at Studs on a Saturday night, then I can understand a thing.
So once you test positive, we connect you to treatment. Then once you start the treatment, within the first 2 to 3 months after taking treatment, and treatment means 1 pill a day.
Wow, it's not like before,
Not like before.
the 10, 12 pills.
Right. So starting on that treatment, 1 pill a day, can make you undetectable. Once you're, which means your viral count level has dropped.
Perfect.
Once you get to the undetectable part, then you cannot transmit it. So helping people get to the level where they're not transmissible is prevention.
Mm-hmm.
We're preventing the spread. So we're helping our community in the long run. People still have fear of coming in to get tested because they don't know what to expect.
Wow.
What we've tried to create is an environment where people feel comfortable coming in. They're not going to be judged. They're not going to be looked at differently. And we treat everybody with respect, dignity, and greet them with a smile.
Yeah, because you bring a little family thing in there. It's
Yeah.
like a family vibe. It's like going to see friends.
So one of the things I've tried very hard to create there is to create an environment where you would feel comfortable bringing your mom if you needed to.
Mm-hmm.
You're not going to be embarrassed because no one there is going to see you differently, judge you, or be scared because you're coming in and it's your first time, or you don't know what you're getting into. Our nurse there, our doctor there, they're all very gay friendly.
Perfect.
And they've worked with the community for at least 5 years.
Wow. Okay, so they know the shit.
Yes.
Okay.
They know you don't have to worry about getting in there and having someone make a face at you because all of a sudden you're getting tested for HIV.
Yeah, because that's a big thing, People are scared about testing. Like, oh my God, they're gonna think I'm a slut. Bitch, you are. But it's good. It's good to be a slut. And if you can have someone to help you to be a good slut, well, that's amazing, because people are scared sometimes to say, what's gonna happen to me? It's like, even if it's when it's not HIV, it's like, oh my God, I have a gonorrhea, or I have a chlamydia, because this is getting higher and higher in Mexico and around the world.
It's around the world. I wouldn't just say Mexico. I think, last year when they identified a big increase in syphilis, and it was a worldwide
Yes.
syphilis epidemic, our board at the clinic decided to do a free syphilis testing and treatment campaign.
Yes, I remember that.
So anybody who came to the clinic who wanted to get tested for syphilis, tests were free. And if they tested positive for syphilis, then the treatment was free too.
Wow.
So it was very successful for the month of August that we decided to see it through. the end of the year, and it continued. So throughout this year, we were doing free syphilis tests.
Wow, that's
Now,
amazing.
most recently in November, we started working closer with the Secretaría de Salud del Estado de Jalisco, which is the health department,
Yes.
the state health department for the state of Jalisco. And they are now providing free the testing supplies to us.
Nice.
So because of that, we've made the commitment to offer free HIV and STI testing to anybody who walks through our door.
That's
So
amazing.
I think that's something that I am personally very proud of.
You should.
It's one of
You
the things
should.
that us, the board, and the clinic were shooting for, but it was very hard to do when you have to buy supplies.
I know.
But now that the state is donating the supplies, then we can do it for free for everybody who walks through the door.
Yeah, because a lot of the people here also, we understand that the salary, you know, tourists can go, but sometimes the salary is a little lower. So to pay for a test, and I know that there's some clinic here, they charge you 500 pesos for a test, but just for that, sometimes it's a week salary or a day salary.
Yeah.
So to have it free, it's like prevent that more people can go.
Yes.
That's amazing.
You know, so and all of our services are. So any of the support groups that you come to are all free. I wanted to make sure that people that came didn't have to worry whether they had 50 pesos in their pocket to join the group.
That's
You
amazing.
know, so anybody who makes it there and wants to participate is welcome to come. If you want to make a donation, yeah, we'll take your donation, but we're not going to turn you away if you don't have it.
Excellent.
You know, I wanted to create a space where everybody felt welcome, everybody had a safe space to come to, and everybody was part of a bigger family.
Well, we're going to talk about money just right after those words. And thank you so much for being here. We'll come back in 2 seconds. So, Pedro, tell me. We were talking just before the break that all the service at the Vallarta Gay Plus Center is free. Okay? But you also accept all the donation, right?
Yes. So all the community center activities, the groups we have for substance abuse, if you're using the substance and want to stop using, we have a support group for that.
So you have a support group from NA and AA, right?
Yes.
Wow, this is amazing.
And that's Fridays from 9 to 11. We also have a group for people that live with HIV, and that's from 6 to 8 on Fridays. We have a yoga group. We have a Spanish group for people that want to learn Spanish. We have an
Nice.
English group for people that want to learn English. I think our board is very committed to helping our community grow financially and be able to have a better quality of life. And we believe that if you educate people and teach them English, that offers them an opportunity to have a better paying job.
Of course.
So anybody who wants to learn English is welcome. We also have a trans group. We have a salsa group. We have different and a drawing group for beginners. And all of those services are free. Anything in the community center is free.
And it breaks also the como dice, isolation.
See, so one of the things that as the center started, we were committed to is holding focus groups to understand what the community needed. So it wasn't just the board and Pedro saying this is what we're going to give you, but we actually had people come in, participate in focus groups to help guide us on what we were going to offer. So we started with the initial focus group of youth, sex workers, cis women, and trans women, or trans community. And they guided us into what kind of services we should offer. And that's how the programs have been developed.
And it grows and grows.
Yes. The PrEP and the PEP services that we offer, so those do have a recommended donation. So we ask people when they come in, this is, I believe, once you come in for your second visit, you get 3 bottles of PrEP, and that costs, the suggested donation is 500 pesos.
Wow, that's...
Yeah, so each bottle would cost at least 2,000 pesos if you had to buy it, if not more.
And even more when you're living in Canada or in the US or in Europe.
Yeah, so we're committed to making services accessible. Now, if someone comes in and they say, you know what, I can't afford the 500. So we do conduct a socioeconomic study to see how much can you afford. And if what you could afford is 300 pesos, then that's what you pay. If you come in and you say, you know what, I can't afford anything, then we're going to get it to you.
Perfect.
Our goal is for you to stay healthy. we're not in this to get rich.
Mhm.
We want to make sure that our community stays healthy.
But we want also all of you that are watching to help, because you come here in Vallarta and you can get it tested. Sometimes they're making a lot of parties. Sometimes that you don't understand the party, but also there's a lot of way to help, like donation and all that. But also those little red bucket that you can find everywhere
They're everywhere.
in Vallarta.
So it's the Red Bucket Giving Campaign.
Mm-hmm.
We kind of stole it from the Salvation Army.
But it's okay.
So
You prefer this one?
so you'll see them at all the different locations throughout the Zona Romantica. Mexican coins are very heavy. Don't put them in your pocket. Put them in our
No.
bucket. And
A lot of tourists are like, what I'm going to do with that?
Yes.
That's what I tell them. Put it there. Put it there.
Yes.
It makes them heavy, but more heavy, better it is.
Yeah, and about once a month we go out and do a round to pick up our donations.
Perfect.
And we're very grateful for people to put in money there.
And also, there's a lot of I know here at Studs Bear Bar, we're always doing like either bingo or events or fundraising also. But there's a lot of fundraising around in La Zona Romantica for the Vallarta Gay Center. So, guys, girls, all in between, you should come, mi amor, to help this center, because this is amazing. I wanna know. Do you have numbers for me? Like people that come in treated. How many did you start, and now how much you are?
So when we started 2 years ago, we were at 0.
Okay.
But I can share numbers of how many people we've served this year, because I just tallied up the numbers to provide a report to our board, and I can share with you that there's over 750 clients that come in
Wow.
that have come in this year to receive PrEP.
Wow, this is good.
So we've got about 750 clients within our community that are taking PrEP regularly,
Mhm.
and that amounts to about 2,500 PrEP visits a year.
Wow.
So we've had those many visits. Now, for our PEP visits, those are people that have had high-risk contacts without any protection and need PEP. So those we've had 88 visits. And we've had about 27 people that have come in for testing, that have tested positive, and we've got them connected to treatment,
Perfect.
whether it's Capacites or EAMS if they have EAMS, or any type of insurance, or if they want to pay a private provider, we also connect them to them too.
Yeah, because you are also doing some collaboration with the Vallarta Medical
Vallarta
Center.
Medical Center, yes. So one of the things that I'm also real proud of is establishing a convenio, an agreement with Vallarta Medical Center. So any of our clients who need medical services, medical treatment,
Mhm.
can go there and receive a discounted rate because they're affiliated with us.
That's just
So, and healthcare, even though it is less than states in the US, but it is still high. So
It
I
is.
think that is a good convenio that we established. I'm really proud of working with them.
Well, it's all you and all the board that you did, mi amor, because if there were no people working for that, they would pay the full price. But this is just wonderful. This is like I told you at the beginning, it's a gem to have that here in Puerto Vallarta, and you guys and girls and all in between work so much on this, because you're not paid for that. It's like you're like, I think that yes, you will have a salary, but I think with
Well,
the amount of work you do.
I want to rephrase that. No one's in here to get rich. However, I do. One of my biggest commitments when I first started in the center is to make sure that our people who worked for the center, had a decent wage, a living wage,
Yeah.
and that they all had the medical care and the benefits that they're legally entitled to.
That's amazing.
And that's very expensive.
It is.
But the board and myself are committed to making sure that if they're committed to taking care of our community, then we're committed to taking care of them.
Yeah, because you prevent jobs also. You're bringing jobs also there.
Yeah.
This is amazing, mi amor. We're going to
Thank
take
you.
2 minutes because I think it's time for a double D segment. And just right after that, we're going to talk a little more with my guest. Welcome to my segment called Double D with Tia Gloria, because double D's is do's and don'ts. Do get tested, mi amor, even if you don't feel like it or if you feel fine. It's important for yourself. Do Do talk it openly with your partners or multiple partners or lovers because protection status is important. Do. Do you know your option, baby? You know there's PrEP, Doxy, condoms, everything. And flirting with the Lulu is not an option. Do. Do respect the boundaries, baby. Do. Do take care of your mental health, baby. It's also important, okay? Take care of yourself, your head, and the other head too. Don't. Don't assume someone's status by the way they look, because someone's status is not a new fashion line that you can get a Q on it. Don't. Don't judge someone or shame someone about their status, mi amor. Don't be a shithole. This is important. It's like support. It's needed. Don't. Don't think won't happen to me. I'm not a slut. I'm not a whore. Babies. Everything goes to everyone, and don't be ashamed to be who you are. Don't. Don't be afraid to ask questions, mi amor, either to your partner or to a specialist, because you know what? To feel dumb, that's not sexy. So just be sexy. Think about everything you want to know and ask your question. That's the most important thing. Don't. Don't share all your protection if you are in a group sex, mi amor. Because condom is not a reusable Tupperware that you can pass around in everyone, baby. Get your own. You know, mis amores, be smart is sexy. It's like be sexy the way you want, but don't be afraid to ask questions and to not to be scared, and don't take anything for granted. This was my double D's. So Pedro, my love, I have two other little questions that are really important for us. First of all, why is still in 2026 important to test for STI and HIV in Puerto Vallarta, but all around the world?
You know, it's important because the only way we're going to be able to defeat HIV is through testing. 35 to 40% of the people that live with HIV don't know they are carriers of HIV.
That's surprising me a lot.
And the only way we're going to be able to stop that is by testing. And testing for STIs, the only way you're going to know is through a test. But that doesn't mean you're not continuing to spread the STIs.
Yeah,
or the
for
HIV.
sure.
So it's important to test because that's the only way you're going to find out.
And I know there's a stigma also. We talked about it, about the fear and all that.
Yeah. So everybody thinks that when you come in for an STI, you got it because you were doing something bad, something dirty. But you know, we need to take the shame away from that. There's nothing dirty with having contact with someone that you love or you like.
Shame, to love, contact, that's my kind of words.
You know, but when you test yourself, you're not only taking care of yourself, you're taking care of your partner.
That's important.
So it's important to get tested. And not too long ago, as I did some rounds with a couple other organizations, and the question came up about what services do we offer for females, because there's been an uptick in stay-at-home wives that are testing positive for HIV. So PrEP works for men and for women.
Okay, it's for both people.
For both. So if you are a cis woman who is in a high-risk relationship and you want to come in and get PrEP, want to get services, want to get tested, come on in. Services are for you too. The Vallarta Gay Plus is for you.
Plus is for you, because we have to break this. You know, maybe you can say that, but I can, because we know here in Vallarta we are celebrating the sex worker, and also, but we have a lot of straight men that are into gay for pay. We understand that, or massage amigo, or everything that will go to have fun with their wife after and gonna transmit what they got. You know, it's like, so it needs to be like prevented, and I think this is amazing that this is for everyone. So you're not gonna say to a woman, sorry, it's not for you. The plus is for them.
Yeah. Anybody who walks through a door and wants to receive PrEP, you know, they'll speak to the doctor, they'll receive an evaluation, and if they're appropriate, then they get it. And PrEP, again, it's not just for men, it's for women.
And we're not sponsored by deodorant, you know, it's not just for men. Or beard. I'm joking. Okay, mi amor, thank you so much for being here. But I have a little game that I love to play with my guests. And I call that the tea sip segment. So I got 10 questions for you. It's rapid question, okay?
Okay.
You don't know I didn't show you that page. I didn't show you that paper. I want you to answer me honestly, and it's really fun, okay? First of all, coffee or tea?
Coffee.
Coffee. Okay, one word to describe PV community.
Friendly.
That's amazing. Okay, favorite guilty pleasure.
Guilty pleasure. Chocolate cake.
hmm Love that. And they have so much good one here in Vallarta also. Okay, biggest myth about sexual health.
Biggest myth? Oh God, I'm stuck on that one. Biggest myth on sexual health. You can't get pregnant the first time.
Okay. It's not because we don't practice, but if that maybe I would have so many babies. All right. Best PV jam for you.
PV jam?
Yeah, a little place or something that for you it's the best little jam in PV.
Studs.
Thank you, baby. My boss gonna love that. But it is, and I love it because Studs is also a welcoming place.
Yes.
That's really good. Okay, one thing people misunderstood about Vallarta Gay Center.
I think the one thing that people misunderstood is that some people when we first started did not feel welcome there because they didn't feel that the center was for them.
Okay.
I think we've worked hard to change that and we've been successful.
I think with all the publicity also and what we can see on your social media that you can check on, you are on Instagram, on Facebook, you're
Yes.
everywhere, the Vallarta Gay Plus Community Center. Go check them, go like them, and if you can do a little thing for it, don't forget. Okay, I need an escándalo secret.
Escándalo secret.
Yes, from you, something that you didn't say to no one or only your husband knows or...
My life has been so boring. I don't have any scandals.
He doesn't have time for a life. No. Welcome home, bitch. Okay, if you have to eat one food for the rest of your life, what would it be?
Mangoes.
Mango.
I love mangoes.
Wait, do you put tahini on it?
Oh no, fresh
just
mangoes just...
eat it up raw. Okay. Your best mama advice, an advice that your mama told you. Mama Pedro, she said something, and it's the best advice that kept for all your life.
That man is not good for you.
And you didn't listen to her?
I didn't listen.
You married one.
Yes.
And your best moment at the Vallarta Gay Center?
Oh, you know what? There's been so many of them. But I think one of the best moments has been when our doctor that's on the board ran into a man that was dying with AIDS under a bridge and brought him into the center, got him started on, we did lab work, got him started. He purchased the medication he needed. We got him connected to Capacites. He helped get his birth certificate, his INE, so that he could be treated because they weren't treating him because he couldn't provide identification.
Wow.
So I think that's been one of the nicest things that
I got chills. They're multiplying.
You know.
Wow.
And that's not our role. We don't provide treatment. We provide detection and referral. But our Dr. Mitch, who's on our board, and who's been an HIV provider for many years in the States, but is now retired and lives here. He saw him and knew that he was dying, and he brought him in, took care of him, and he's back on his feet.
That's amazing. Thank you so much, Pedro, to being here with me. You're a gem. Everyone at the Vallarta Gay Center are amazing. Tell them we love them. You're always welcome here to the show. You just want to talk about anything. It's going to be so fun. But one last question before I let you go, because your husband's going to ask where the fuck Tia bring my husband, okay? What's the future of the Vallarta Gay Plus Center?
So, there's a couple of things that we want to see continue. The most important one is continue to make services accessible so that people that can't afford services otherwise can still get treatment. The one that's really close to my heart, and we're going to see it through this next year because I already have a mom lined up for it, It's creating a space, a group for parents who have gay kids
Wow.
to come in and have a safe space where they can talk about it. You
That's
know,
amazing.
I've always said that coming out of the closet, you don't come out of the closet, you just make your closet bigger.
Baby, I don't come out of the closet. I come down off a pantry. I'm a fucking snack.
You know, so I remember coming out of the closet, telling my parents, my brothers, but they didn't feel they could tell anybody.
It's really.
So I just brought them into my closet.
They're feared. They're
Yeah.
scared to talk
To-
about that.
Yeah,
Because
you know.
they're not. That was not in their days.
Yeah.
You know, they didn't learn about it.
So if we could create a space where parents can come in and talk about what their fears are, being able to talk to parents that have grown gay kids that, you know, turned out okay, and creating a space, a safe space where they could have those questions answered. I
and
think,
connect also with other
yes,
families.
and if we really want to impact social change, we need to start at home with the moms,
That's
because there is nothing a Mexican mom is not going to do for their kids.
I know they will die for you.
Yes.
They will
So
die
if we
for
can
you.
help support them, we will see the difference.
Thank you so much, my love. Thank you so much to being here.
Thank you for having
And
me.
don't forget, guys, girls, all in between, please, if you are going at the Vallarta Gay Center in Puerto Vallarta and you have few pesos or all that, or you're coming for a bingo here at Stuz, or you're going to a charity events for the Vallarta Gay Plus Center, please donate. We need that because, see, everything is like free with donation also. And if you're going there and you have the money for it, please help, because if you pay for that, it means that someone that don't have the money gonna still have it free. Thank you so much, baby.
Thank
and
you.
for you, we're gonna see us in a second because we're gonna have the word of the end with Tia Gloria. And that was our show, mi amor. So that was Tea Time with Tia Gloria. Thank you to being there. I love you. And thank you to Pedro Lopez, our executive director from the Vallarta Gay Plus Community Center. Go follow them on their social media. It's important. Share the love, share the word. And I'll see you next week with a different guest. Hasta la próxima, mi amor. Ciao.
From Stud's studio, it's tea time, my darlings. Tea time with Tia Gloria. Tea time with Tia Gloria. Hope you had a good time. See you soon, Miss Amores.